Wait a while as usual for people to join us. It's the first Saturday of the month, and of course, people up and about. It's the long weekend. So, for those of you who are not catching it now, I hope you're catching it later. Yes, so we're doing another series on sustainable smoke free cities and communities. And of course, that's a very important part of being sustainable as well. I'm here, Frida Liu. I'm going to introduce my guest in just a moment. I'll give it a minute for people to sort of settle in and join us. And of course, during the course of our conversation, if you have any questions for Pankaj, not me, any questions for us, but do just drop it in the chat box, and of course, we will look at addressing them as much as possible. I know he will have the answers. Or he will have suggestions anyway. Okay, now, yes, so we're doing another session on sustainable smoke-free cities and communities, and today is about the impact on economic health, right? So on May 31st, we recognize World No Smoking Day, and in the beginning of the year, DARE, short for Data Metrics Research and Information Center, launched a report entitled "Clearing the Smoke: Tobacco Harm Reduction." Now, DARE is a think tank performing research and advocacy for a multitude of topics, and of course, they come in and advise also on how policies can change, and I guess assisting the government in ways that we can move forward. Now, all in that report revealed that adoption of tobacco harm reduction or THR strategies could be a game changer in managing the smoking prevalence in Malaysia, which remain largely stagnant for over a decade. So I'm here with the managing director of DARE, Pankaj Kumar. Good morning, Pankaj.
Good morning.
And I just realized that he's down the road. Really, we're down the road, and we could have just done this together and had a cup of coffee and have this chat over a cup of coffee next to each other. So I think, okay, we've got a question here already. Okay, when you say smoke-free cities, does this mean from vehicles or from cigarettes? So for at this point, right, there's so many aspects. Today we're just covering on what do you call it, on the whole topic of smoking, right? Because it was World No Tobacco Day. But I think today's topic, greetings from Hong Kong. Hi, Charles. Today's topic is really about when we try to move towards smoke-free cities, what are the implications along the way? Because we have these grand visions of what cities could look like and all that, but also what is it the impact on the economy? So that's what we want to talk about now. As I was saying earlier on, DARE launch a report entitled "Clearing the Smoke: Tobacco Harm Reduction." Please share the key findings from that report, Pankaj.
Well, first of all, thank you, Freda, for having me on the show, and good morning, everyone who are listening in. I think on the report itself, their focus was actually finding alternative solution, to this perennial problem that we have, as to how we tackle smoking prevalence in the country and what can be done to help smokers kick the habit. Of course, when one talks about tobacco harm reduction, or in short, THR, we are talking about alternative, that are less harmful than direct tobacco smoking. For
Right.
example, if you look at studies that has been done, products are some vape or e-cigarettes are effective, in terms of helping smokers to quit.
Mhm.
And actually, evidence from UK and New Zealand does show that it has given positive result. There are also, of course, other tobacco harm reduction products out there, but perhaps less popular. Of course, this include products like oral smokeless tobacco product, SNAS, which is called SNAS, uh,
Mhm.
and, and of course that is quite popular in countries like Sweden. Newer forms of what you call tobacco harm reduction products includes oral nicotine products, such
Right.
as nicotine pouches that are smokeless, tobacco free, and quite similar in appearance, and of course and use to SNAS.
Mhm.
They are actually showing positive results as well, compared to
Mhm.
direct tobacco related product. So if you
Mhm.
look at Malaysia, if you look at some of the studies that have been done, and based on what we have found out in our report, the Ministry of Health has very ambitious target in terms of trying to reduce smoking prevalence in the country. For
Mhm.
example, we want to reach. We are at about 21%. The last count that we have. but we want to reduce to 15% by
Right.
2025
Right.
and below 5% by 2045.
Right.
So while these are very, I would say, kind of lofty targets,
Mm.
uh, we likely face a lot of challenges, yeah, in terms of reaching the target,
Mm.
because smoking prevalence, if you look at the country as a whole over the last maybe 10 years, has more or less plateaued. Yeah, we have come down a bit, maybe about from 24, 25. Now we are 21. Yeah, despite numerous
Right.
programs, yeah, awareness lah, new laws, tobacco control activities, yeah, over the last 10 years or so, but results has been rather poor, I must say. So,
Mm.
based on our report, yeah, in fact, we also carried out a survey which was done by the Green Zebra. It also showed that 80% of Malaysian, yeah, believe that adoption of tobacco harm reduction um, will help Malaysia or Malaysian smokers, yeah, to
Mm.
quit cigarettes for less harmful alternative.
Right.
We also use statistics from the UK and see if we were to adopt similar approach, we estimate that smoking prevalence in Malaysia can be reduced from what, as I mentioned earlier, we are at 21%,
Mm.
to between 5 and 12.5%, or up to about 880,000 person in the next 4 years,
Mm-hmm.
by encouraging them to switch to e-cigarettes or vaping, yeah,
Right.
as a form of harm reduction.
Right.
This, because if you look at some of the other statistics that the government talk about, and I think this is a big issue,
Mm.
healthcare costs, yeah,
Mm.
which under the previous government, the Pakatan Harapan government, the health minister then actually mentioned that the government is going to spend 7.4 billion ringgit in terms of healthcare costs by
Right.
2025. Yeah, smoking
Right.
related healthcare costs. But if you can switch smokers, yeah, to go towards vaping and e-cigarettes or other tobacco harm reduction, you can actually save. Yeah, because as I mentioned, the
Mm.
statistics, take the UK model, you can reduce number of smokers, yeah, by about 880,000 in the next 4 years. So if
Right.
you reduce that, your estimated cost of healthcare costs, yeah, will
Mm.
reduce by about 1.33 billion, yeah, by
Mm.
2025. So the
Right.
DARE report highlighted other things as well, yeah,
Right.
which of course include regulation, yeah, which is very important, yeah, in terms of addressing the imbalance that we have today in terms of tobacco products and tobacco harm reduction products, and
Mm.
of course a fairer taxation system, yeah, which will differentiate, because as you know, tobacco products, are taxed very heavy, because you want to discourage smokers. You want to tell people that it's risky. But if non-tobacco products or tobacco harm reduction products are less harmful, obviously you must not tax them too much. You must make them kind of affordable, yeah, so
Mm.
people can actually switch. So we talk about risk proportionate taxation system, yeah,
Right.
which means that taxation for tobacco harm reduction products should be much lower than tobacco products. So
Right.
this is something that we actually summarize as far as our reports are concerned.
Right. And there's a lot to go through, which was, I thought, was very interesting. Just a couple of key points that you brought up. But anyway, hi to Tracy. Hi to Carol from San Francisco. Also, Johan had a very interesting question. And I'll sort of address this a little bit. Like, can we just ban the cancer sticks, like how Singapore bans the chewing gum and all that? And that's something that we're going to be talking about in just a moment. And if it was as simple as that, right, it'd be great, right? But we'll address that in just a moment. And if you listen to an earlier episode I had, about the whole topic of addiction. If you can just, go in, and I can share that with you as well. So addiction is another topic altogether. So I'm definitely not pro or against any of these things, but it is something that I guess we have to talk about, especially now. I just want to talk about how, when you talk about the risk proportionate taxes, right? Now, the report estimated that vaping will help reduce, the country reduces healthcare spending on treatment smoking related diseases by 1.3 billion in 2025 alone. That's if we reduce 880,000 people to harm reduction, right? And the okay, and the reason I'm asking is, why not completely eliminate, all these things in the first place, right? And this is, I guess, where Johan is coming from. Why can't we just eliminate everything, right? And wouldn't it be the end of the issues?
Yeah, Freda, I think if you ask me that question, whether can we just eliminate, smoking related diseases completely, I suppose it's possible if no one smokes, but that is
Right,
not going to happen,
right.
So let's face the reality as to the challenge that we really have.
Mm,
So when I talk about the 1.3 billion savings that the country can have if we introduce tobacco harm reduction policy, uh, where we came from was actually looking at data as well as studies that was done in the UK, and how UK's program actually translated to lower number of smokers. So this was actually done in the UK itself in terms of how vaping can actually reduce
mm,
uh, the number of the smoking prevalence in the country.
right.
Based on the research that is conducted, for every 1 percentage point increase in e-cigarette or vape used in quit attempts, it will result in 0.06 percentage point increase in quit success rate.
Right.
And leaving everything else unchanged. This part of the report, of course, it's a bit more technical when you actually
Mm,
research reports and studies that is done and all that.
mm,
And it actually showed that um, there's this report called the Cochrane Review,
mm,
has in its latest 2021 evidence review that looked at 61 completed studies representing 16,700 plus participants. And it indicated that the quit success rate is higher, between 9 to 14% out of
mhm.
every 100 people who are relying on vaping to quit smoking. So
Right.
we use this same data to apply to Malaysia, right? And based on if we use this same data, what we found is that we can reduce smokers by between 140 to 220,000 every year.
Mm,
Yeah.
right.
So effectively, that translates um, to about 3 to 4.5 percentage point decline based on the current smoking prevalence. So that's how we got the 1.33 billion
Right.
in terms of how we can derive the savings.
Right. Okay. You mentioned a little bit about the risk proportionate approach in developing regulations, right? With regulators imposing restrictions in proportion to risk of health. So is that what you just mentioned? And that's how? Can you elaborate a little bit more around that?
Yeah, Freda, if you look at that issue about risk proportion, it's very simple.
Mm,
If you look at direct tobacco products, tobacco. I mean, the taxes that Malaysia impose on cigarettes is very high. In fact, we went very aggressive in 2014, 2015, to the extent that we raised the taxes to about 400 ringgit for every 1,000 cigarettes or something like that.
mm,
So that's very aggressive taxation system, because the government's approach in terms of attacking smoking prevalence is to make cigarettes unaffordable.
right.
But that didn't really help. In the sense
Mm,
that we saw illicit trade actually gone up quite substantially. In fact, before taxes were raised, 1 in 3 cigarettes that are sold in Malaysia were illegal, illicit.
right.
But by the time taxes were raised so high, uh, almost we reached a stage, I think in 2020, the data showed that 63% of cigarettes that are sold in Malaysia were illicit. Yeah, so
Two out also two out of
almost
three.
almost two out of three. So
Mm,
we went up by 30 percentage point in terms of illicit cigarettes.
right.
That is basically because the government thought the best way to reduce smoking prevalence is by raising taxes. Yes, you can raise taxes, but of course, enforcement is key.
Mm,
Countries like Singapore, countries like New Zealand, cigarettes are not cheap. Yeah, even in
yeah.
Australia, cigarettes are not
Right.
cheap. But look at the enforcement.
Right.
All right, so that you need to have that together. Yeah, when you raise taxes, enforcement must be in place at the same time.
Right.
But in Malaysia, that didn't really happen. So going back to the question about risk proportionate, yes, because it's harmful, we discourage you from smoking.
Mm,
But if vaping products or tobacco harm reduction products are less harmful, do we impose the same taxation system? Right?
mm,
So that's
mm,
what it means by risk proportionate. Yeah, we
right.
we we have because you want to encourage people to switch.
Mm,
Yeah, so it has to be something that is cheaper, less hurting on the pocket. Yeah, for
mm,
people who are smoking. You know, cigarettes are not cheap. Yeah,
right.
so if you tell them, hey, if you smoke this, is less harmful to you and less burden to you financially. Yeah,
Right.
because the taxes are lower. So of
Right.
course, then people will be encouraged to switch from smoking direct tobacco products to tobacco harm reduction products.
Right.
That's what it means.
Okay. We're talking about this, some the taxation framework, right? Which is being planned at the moment. Do you know what that will look like yet, and what kind of tax revenues are we looking at once that is in place? Do you have an indication?
Hmm, I think if you go back to what the government had introduced in 2020 and 2021, yeah,
Mm,
um, when you talk about tobacco harm reduction products, or in short, of course, in short, we are talking about vaping or e-cigarettes, the government actually introduced some form of taxation. Yeah,
mm,
in the budget 2021, the government introduced an excise duty of 40 cents per milliliter. Yeah, effective
okay.
January 1st, 2021.
Right.
But in budget 2022, which was presented last year, because the government wanted to extend what do you call the excise duty, not only on e-liquid nicotine based, sorry, non-nicotine based, but also nicotine based. Yeah,
Mm,
but what the government did, instead of 40 cents per milliliter, they raised it to 1 ringgit 20 cents per milliliter.
right.
Yeah, which is three times more than what was introduced a year before. And if you ask those who are in this, what do you call, segment of the society who are
Mm,
vapers and e-cigarette smokers
mm,
and all that, you realize that at 120 per milliliter is almost equivalent to the actual price of the product. So effectively, it's double. Yeah, the
mm,
price becomes double if you introduce this tax of 1 ringgit 20 cents. So
mm,
we have, for example, I think if you look at the Malaysian Vapers Association MVA or something like that,
mm,
it shows that we have about 1.12 million vapers in this country. Yeah,
mm,
probably now maybe slightly more.
mm,
But at the same time, it really depends whether this number is really growing
right.
and what is their consumption pattern. Yeah, as well as how we can encourage smokers to switch. Yeah, to vaping.
Mm,
That will basically result in government's revenue to improve if this taxation system is introduced.
right.
But so far we find it difficult to really quantify what is the actual tax revenue that the government will collect
Mm,
from vaping products or e-cigarettes. But we do know, for example, as far as the direct tobacco products are concerned,
mm,
yeah, we can say that, for example, in excise duties,
mm,
the government collects about 3.2 billion a year,
mm,
yeah, on
mm,
excise duties alone. And of course, the government also collects income taxes from tobacco companies. Yeah, so all in, the government collects probably about 3.5 to 3.6 billion a year, yeah,
Mm,
in terms of taxes. But at the same time, because the illicit market is so big, yeah,
mm,
which is the majority of the market, the government is also losing out in tax revenue.
right.
Yeah, and our report, in the previous report, we actually also mentioned about this, and we calculated that the government actually is losing about 5 billion ringgit in terms of tax revenue, yeah, because of illicit trades.
Right. Okay. So there's a question here. What's your view on the generational end game economically and health wise? And for those of you who don't know what the generational end game is, for those who were born in 2005, no access to anything that's nicotine related, right? What are your thoughts around this? And I've got a couple of comments here. I've got one here from Gerald Fernandez. He says, not something popular to say, but purely for health reasons, people should stop smoking. On the pack itself, there's a huge information of health issues. We should regulations, but then again, the billion-dollar rich tobacco industry would go berserk. Okay, and these are the things, okay, interest, I know what you're trying to say here, and of course at the end of the day, yeah, stop smoking, right? And he said you're just shifting the goalposts of nicotine addiction, the burden to health remain. Don't be fooled, there are now 1.12 million vape nicotine addicts, so it's all about the business profits. To this speaker, Pankaj, okay, explain yourself. But okay, we can comment on this a little later, but just let's
Yeah.
talk about the generational end game first.
I think this is a very huge topic, and of course, you see the Malaysian health minister championing the cause, yeah,
Mm,
in terms of the generation end game. But we need to explain how we came about this generation end game in the first place.
right.
Of course, if you look at what has happened in the past few months,
Mm,
generation endgame is the term that is actually defined to ensure that future generation is free of tobacco
right.
and its harmful effect, you know, to the society. And of course, this is a topic that is hotly debated, not only just now in Malaysia, but of course in Singapore way before, uh,
Mm-hmm.
and of course New Zealand. In
Right.
fact, New Zealand made, in a way, history, yeah, because on December 9th last year,
Mm,
they announced plans to make New Zealand smoke free,
right.
yeah, and to make it illegal to sell cigarettes to anybody born after 2008 in 2027.
Right.
Yeah. So New Zealanders coming to legal age will never be allowed to buy tobacco legally. And if you go back after what happened in New Zealand, Singapore stepped up its plans.
Mm-hmm.
Yeah, that it also wants to have generation endgame. But actually, Singapore has been talking about this for a while, but they have not really implemented just yet.
Right.
And of course, Malaysia also introduced or made its intention known when the Minister of Health was at a convention of WHO, and he says that Malaysia will also introduce law to have generation endgame. But the question is, of course, I mean, if you look at what New Zealand is doing, what Singapore is trying to do, and what Malaysia is trying to do, yeah, the
Mm,
question is, of course, are we ready for tobacco generation endgame?
right.
Yeah,
Right.
so that is the important question to ask first
Mm,
before we say that yes, we must do it,
mm,
right? So we look at the dynamics of the Malaysian market, the dynamics of the New Zealand market, and the dynamics of the Singapore market. Yeah, and as I mentioned earlier, we have smoking prevalence in the country, which is about 21%. And I mean, you can find this information on the internet and some of the reports out there. You will know that New Zealand and Singapore has very low smoking prevalence in the first place. It's only between 11 to 14%. Yeah,
right.
in these countries. So it's about half to two-thirds of what the smoking prevalence is in Malaysia.
Right.
And of course, then you got to
Population
ask,
size as well.
yeah,
Yeah, population size as well,
yeah,
right?
population size is another
Yeah.
issue. I mean, New Zealand is what, 3, 4 million? I don't know, 3 million plus.
Yeah.
Singapore is 5 4 million. Malaysia is 32 million. Yeah, and of course we have 2 million or 3 million more, uh, you know, uh, 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 workers who are not legally recorded.
Right.
Then the question is, of course, not only comparing in terms of the smoking prevalence in the country of New Zealand or Singapore, we also got to see what is the level of illicit trade in these two countries.
Mm.
Again, it's very low. Yeah, it's
Mm.
about 12%, 15% kind of thing. And we are at 57%. All right. So, yeah, the tobacco industry dynamics in Singapore and New Zealand is very different than the dynamics that we are in Malaysia.
Right.
So, on that basis, I find that, Malaysia is actually not ready
Mm.
to introduce Generation Endgame, because what will happen here?
Right.
Simple. Yeah. When you introduce laws related to Generation Endgame, those who are affected, yeah, or even if they are smoking, but for example, if they're smoking legal cigarettes,
Mm.
and because it's banned, they will find ways and means to still continue smoking.
Right.
Yeah,
Yeah. And I think that's the point, right? I mean, we're saying that it is a noble thing to move forward, but whether we're ready to implement it at the time that we're expecting to implement it, because at what we were planning, everything goes as planned. Those who turn 18 next year will have no access to anything tobacco related and be deemed illegal. So that's the plan, right?
yeah,
And so, and then my question would, do you think the black market growing like it did, right? And here's the thing, right? You just mentioned about the percentage of illegal cigarettes coming in anyway at 60%. Enforcement,
yeah, correct.
right? That's one thing. And for someone who's born in 2005, you cannot buy, but you speak to your friend who's born in 2004 who can buy it for you. That's the
Yeah,
thing, right?
yeah, yeah,
So whether, and this is New Zealand's looking at it a bit later for those born in 2008, right?
yeah,
Okay. Okay. Now, so, in an article in NST, you mentioned that leaders must be open to exploring new science based solutions that have proven to be effective in countries such as the UK and New Zealand. And you mentioned this earlier. So, what are some of the trends? I think moving forward, what are some trends and strategies that can be developed so that, we do move towards this, but let's move effectively towards this
yeah,
goal?
correct, correct. So if you take the example, especially in countries where tobacco harm reduction has been used as an alternative, yeah, to address smoking prevalence, New Zealand and UK are very good examples to look at. Yeah, in fact, if you look at New Zealand, for example, um, even just in the last year or so, yeah, their strategy in terms of reducing smoking prevalence has been successful, yeah, and that has reduced number of smokers. For example, in New Zealand in 2012, number of smokers in the country were about 16.5% thereabouts,
Mm.
and they came up with programs for tobacco harm reduction, in particular e-cigarettes and vaping. Yeah, and today the smoking number of smokers in the country has reduced to about 11%. So
Right.
you can see that effect has been positive. Yeah, in that sense. And of course, if you look at the UK, they too have made extraordinary progress in terms of reducing the smoking prevalence in the country. There was this report called Action on Smoking and Health,
Mm.
ASH, in
Mm.
2020. Yeah, e-cigarette use in Great Britain declined for the first time, falling from 7.1% to 6.3%. Yeah,
Right.
so that again showed that there is a trend where number of smokers are actually reducing.
Mm.
UK, in the other example you can see is that in England and in the UK,
Right.
smoking prevalence was almost 20%. Yeah,
Mm.
and it has now dropped to about 14%.
Mm.
Yeah, so again, you can see that the trend has been positive when you have tobacco harm reduction. Then one of the things that you see different, yeah, in countries like UK, for example, is that, let's say if you are a smoker and you want to make efforts
Mm.
to reduce or to kick your habit, the hospital or the clinics will come forward to help you,
Right.
right?
Right. Yes.
And one of the ways they do it is that they encourage you to try less harmful products for
Right.
free.
Right.
All right. So in a way, you help people. I mean, we talk about addiction. Yeah,
Mm.
smoking is an addiction, just like alcohol, just like gambling or any other
Right.
vices. It's
Right.
all an addiction. How you need to address the root of the problem.
Right.
All right. So to
Mm.
me, by helping people who are smokers, for example,
Mm.
yeah, by giving them alternative, help them, yeah, make it affordable,
Right.
give them for free for a period of time even,
Right.
yeah, to switch, yeah, then you'll see results. So
Right.
that is an important message that I wanted to share as well.
Right. Okay. And help people in the process. And Andy, I appreciate your feedback as well. And I think that's the thing, right? We want to have this conversation, and of course, we want to work towards obviously a healthy country, right?
Yeah,
And of course, but there are implications along the way. Each country is different, and we want to work towards smoke-free cities and communities. That's the point, right? And we appreciate suggestions, right? And feedback and things that we can work on. And I'm sure that people will appreciate that because it's a topic that's very difficult. It's never right, right? It's never right. Of course, it's not something we're promoting, but it's something that needs
yeah,
to
we're
be
not
discussed.
promoting it.
It's something that needs to be discussed. What are the implications? Each country is different, and that's the point, right? Encouraging conversation and dialogue that will have any questions. So anybody, if you have any questions on how we can look at it or suggestions on how you can implement this, we do appreciate it. But if not, any final thoughts, Pankaj?
Well, Freda, I think the issue about the tobacco industry is not just about generation endgame. There is a bigger picture out there, which is, I mean, what is our objective? Our objective is to reduce number of smokers in the country. Yeah,
Mm.
and if you have that objective, as I mentioned earlier, 2025 we want to achieve 15%,
Right.
2045 we want to achieve 5%.
Right.
How do we go there?
Right.
Right, the only way we can go there is if we have effective enforcement,
Mm-hmm.
if we have regulations that allow tobacco harm reduction products to be introduced in the market,
Mm.
allowing people to switch from depending or addiction to tobacco to products that are less harmful.
Mm-hmm.
Yeah, and of course, at the same time, we must have regulation. Yeah,
Mm.
regulation is very important. Yeah, because we don't want to have tobacco harm reduction products out there which are not regulated for safety
Right.
concern.
Yes.
Yeah, health, that could also be health issues. Yeah, if the vape liquids, for example, that are sold in the market are
Right.
not regulated.
Right.
So you need to have regulation, and of course, at the same time, it's about enforcement.
Yeah.
Yeah, I mean, Malaysia really lacks enforcement. We have all the laws that you can think of, but
Yes.
enforcement is clearly an issue. I
Yes.
mean, why do you see that countries like Singapore and New Zealand being successful in terms of reducing smoking
Mm.
prevalence and, of course, tackling illicit
Mm.
trade at the same time? Whereas
Mm.
our borders are so loose, yeah, for us,
Yeah.
to the
Yeah.
extent that our shores, whether it's east coast or west coast or whatever coast,
Yes.
people are coming in easily, smuggled.
Right. Right.
Yeah,
Right. So
so enforcement is key.
enforce. You're right. Right. That whole thing enforcement. There's a joke in Sarawak where you can get a lot of things illegally, and they said, "Oh, did it come in the port? No, it came in the submarine." Uh, yes, so there's so many ways of coming into this country, right? I mean, and that's the thing, right? Enforcement, as you say, at the end of the day, as we strive, right? I think to reduce, 5% by 2045, and
Yeah,
realistically these goals, and that comes in hand with participation from the public, from the community, and of course, from the government as well. On that note, Pankaj, thank you so much, and thank you everyone for listening. It's a difficult topic that needs to be discussed, right? And something that hopefully that can come up with something more concrete, right, as we move on as well. So thank you again, Pankaj. Have a good
thank you,
weekend.
Freda, for having me.
I'll see you down the road later.
Okay,
Okay, take care. Have a good
bye.
weekend. Bye.